In our introduction, we have learned that the drug to move from the lumen of the small intestine to the portal vein, it must pass through the cell membrane of the mucosal cell. Okay, then it moves to the systemic circulation with the veins that drain the liver and is now absorbed. Okay, so we can say that absorption occurs through passing cell membranes. So to know what mechanisms of absorption are, we must know the mechanisms of passing through cell membranes. First of all, we have to know that when a drug moves from area of high concentration to area of low concentration, that's called diffusion. And when this diffusion occurs without the aid of anything, it's called a passive diffusion. So, how can this occur? This applies to a drug which is found in a high concentration outside the cell, and it can pass through the cell membrane easily or passively, as the name says. This can occur if the drug is sufficiently lipophilic, so it can dissolve in the lipid bilayer of the cell membrane. So, does that mean that only the lipophilic drugs can pass by passive diffusion? No, hydrophilic drugs also can pass. How? There are small channels or pores in the cell membrane which are aqueous. Through these pores, hydrophilic drugs may pass, but they have to be small in size. Okay, so by this mechanism, two types of drug can pass. The lipid-soluble drugs dissolved in the membrane and the small water-soluble molecules. And this mechanism, the drug moves along the concentration gradient from high concentration to low concentration. So, does this mechanism require energy? The answer is no. The concentration gradient here is the driving force for the movement of the drug. But what about if the drug is present in high concentration outside the cell but needs something to aid its movement? Okay, moving from a high concentration to a low concentration, it's again a diffusion, but now it's facilitated by another thing. So it's called facilitated diffusion. But what would facilitate the movement? It's a carrier. When the drug binds to the carrier, it goes what's called a conformational change, as we can see here. Our drug binds to a transporter or a carrier, and then it goes under what's called a conformational change. It changes its shape, and now our drug is now inside the cell. And again, this mechanism doesn't require energy. It also occurs according or along the concentration gradient. Okay, what about if our drug concentration outside the cell is less than its concentration inside? Then now our drug movement is no more passive. it now needs energy, and that transport is called an active transport. This transport also needs a carrier. So this transport needs energy, and that energy comes from breaking down ATP into ADP. This conversion from ATP to ADP, this is what makes the conformational change of the carrier to occur. Okay? The fourth mechanism is called endocytosis. And in this mechanism, the cell membrane engulfs the drug in, and it forms a vesicle. This vesicle is hydrolyzed inside the cell membrane. And when it's hydrolyzed, it releases the drug inside the cell. This mechanism is for large molecules, such as vitamin B12. Vitamin B12 is absorbed from the small intestine, binding to a protein produced from the parietal cells of the stomach. This protein is called intrinsic factor. Okay? And this type of transport or mechanism doesn't need energy. Okay. Those were the four mechanisms of absorption. Which of those mechanisms could be described as being saturable? Only the mechanisms depending on carriers could be saturable, because one time a saturation could occur to these carriers and no more drug transport occur before it gets empty again. Passive diffusion don't need carriers, so it's not saturable. Facilitated diffusion and active transport need transporters, so they are saturable mechanisms. But endocytosis is not saturable. Now we have finished absorption. But before talking about our second topic in pharmacokinetics, which is distribution, let's first remember what was bioavailability.